Hi, I'm Dr. Craig Escude, President of IntellectAbility. Welcome to Medical Monday. Today, we're going to talk about sepsis. Now, sepsis affects all of us. It's all of these fatal 5 conditions that we've been talking about, the fatal 5 preventable causes of illness and death in people with disabilities. All of these things can affect all of us, but we see these things more often in people with disabilities. Now, sepsis is basically when your body gets overwhelmed by an infection. It gets into the bloodstream, it spreads throughout the body, and it causes a systemic reaction that can look like fever, chills, low blood pressure, change in level of alertness, change in level of consciousness. If you see that, that means, death could be imminent at that point. It's extremely important that anyone who works in this field understands what sepsis is and understands the early warning signs and seeks medical attention early. Every hour that passes when a person develops sepsis, every hour between the development of sepsis and treatment increases the risk of death by 10%. So minutes matter. If you have someone who is showing signs of this overwhelming infection and the body's immune response to it, they have fever, they have chills, but then they're less alert. They're not doing things the way that they typically do things. They're confused. That is a medical emergency, and you should contact your nurse immediately, or you should contact or call 911. Sepsis, when caught early, has a much more favorable outcome, and people survive sepsis all the time. But what the key is catching it early. And the other key is recognizing that it may look differently in people with intellectual and developmental disabilities. We hear this so often. I've heard it as a physician in this field. Hey, this person's just not acting right, and I get that a lot as a what we call a chief complaint, meaning the main reason that a person presents to the doctor. Hey, this person just isn't acting right. That can be from a million different things. But one of the things we have to keep in mind is that it could be from something very, very serious like sepsis. So if you see early signs, if you see fevers and chills, something like that, you need to act on it early. People who are at more risk are people who have some sort of open wound, like a burn or maybe a pressure wound or pressure sore that's open. That can allow bacteria to get into the bloodstream. People can also get what we call urosepsis from a urinary tract infection. So if you have an untreated urinary tract infection, you can become septic from that, as well as one of the other fatal 5, aspiration pneumonia or any type of pneumonia. We call it pneumosepsis, where you got pneumonia, you became septic from the lung infection. So those are kind of 3 big areas where people are more likely to become septic. So again, if you see this, you need to act fast. One of the things we say at IntellectAbility is, when in doubt, send them out. Basically, when you're in doubt, when you're not sure what's going on, seek medical attention right away. If you want to learn more about sepsis, the clinical pearl number 24 in the book Clinical Pearls in IDD Healthcare is about sepsis. Thanks for joining me today, and we'll see you again soon.